Hello, everyone. Dr. James Marcum here with another biblical prescription for life. And today I want to answer a question in regards to natural remedies. Someone has asked this question: does cayenne pepper abort a heart attack? And I feel qualified to answer this question because I am a board-certified cardiologist. I have practiced cardiology for many years. I've seen many heart attacks in the hospital, some as an outpatient, so I know what heart attacks look like. I have a lot of experience in this area from treating people. I also work with natural remedies quite a bit because I believe in natural remedies. But I also believe more that the Bible has the answers for all of our questions and issues and is a true healing force through Christ. So with that, let me share you a biblical prescription. That's from James 1:5. And whenever I get a tough question that I want to evaluate and look at all the different options and share with you and also learn myself, I always want to start by asking God's guidance, God's help. And I frequently refer to this verse in James 1:5. If any of you, including me, lacks wisdom, let him ask of God, who gives to all liberally and without reproach, and it will be given to him. So as we approach this question, does cayenne pepper abort a heart attack? I want to ask God for his guidance. But more than that, all of these questions that come up, I want to ask for God's guidance. Because in our world now, there's so many conflicting agencies, there's so many people saying things. Many people do it to make money. Sometimes it gets propagated and there's no truth behind it. But so I want to ask God for wisdom as we tackle this. So in answering this question, let's first talk about natural remedies. I believe in natural remedies, whether that be exercise, sunlight, water, eating good nutrition with all the phytonutrients and chemicals that can help the body do well. I've seen wonderful things with hydrotherapy, being outside, light therapy, rest, different herbs, different poultices. So there's many different ways to apply natural remedies. And I think we should reach for the natural remedies, the things that God gave us first. But sometimes we do have emergencies. Sometimes we have bad genetics. So in tackling this question that's been out there for a long time, first, let's talk about how we actually define a heart attack. What is a heart attack? Well, it usually begins with a symptom. Chest pressure, can't breathe. I've seen pain up into the jaw, into the arms, indigestion-like pain, shortness of breath, extreme fatigue, people passing out. So it comes with all sorts of different symptoms. But once a person's having these symptoms, you want to really understand and make a diagnosis. So many other symptoms that mimic a heart attack have to be evaluated. Sometimes it can be a pulmonary embolism. That can cause chest pains. An aortic dissection where the aorta is ripping. That's a medical emergency too. A pneumothorax can present with these type of symptoms. Unstable angina where the artery's unstable. These are all dangerous conditions that can cause chest pain, be very similar to a heart attack. So once a person's having a symptoms, you have to really dig in and ask more questions. Sometimes I'm seeing different types of problems in the gastrointestinal that mimic a heart attack, including esophageal spasm, gastroesophageal reflux, biliary or gallbladder disease. I've seen different musculoskeletal things that can have it. Inflammation of the lungs, of the muscles, even of the heart itself can have these chest pressures. I've seen several cases through the years of shingles, stimulating the nerves in that area that mimic a heart attack. I've seen real high blood pressure, low oxygen, anemia. I've seen anxiety and severe stress cause these type of things. So many different things can cause this sensation of chest pain that looks like a heart attack. So once a patient comes in with having his symptoms, I have to sort of define what the diagnosis is. And we do that by a series of tests, EKGs, blood work, imaging, questions, feeling, history. And once we do that, we can define exactly what's going on. If it is a heart attack, a lot of people don't understand that there's many different types of heart attacks. The most common probably is where you have an artery with a small plaque inside that suddenly ruptures. And when it ruptures, the body wants to clot, it's been damaged, no blood gets to the muscle of the heart. That's what's caused the heart attack. The heart is not getting the blood supply it needs. There becomes electrical instability. Sometimes we have unstable rhythms. The muscle dies. Sometimes the valves don't work well. It's a major problem. That's one type of heart attack. You can have another heart attack where the artery just spasms. It opens and closes. No blockages at all. Sometimes there's a progression of 80 or 90% blockages. You can have heart attacks from what we call demand. It puts a lot of demand on the heart. Anemia, infections, acidosis. Different medical conditions cause a lot of demand on the heart, and that can also simulate a heart attack. So once we have defined that we are having a heart attack, the heart's not getting enough blood, we also have to define the mechanism of a heart attack. So in dealing with someone that's having chest pain, having a heart attack, it's very complicated. So you have to rule out a lot of things. Then once they are having a heart attack, you have to define the type of heart attack. So the word abort, we talk about, the question is, how do we abort a heart attack? So abort means once it's started, stopping it. So we have to sort of define what the symptoms are, making sure that is a heart attack and nothing else. Then we also have to define what type of it is to abort it. So the question here, now that we understand that a little bit better, is does cayenne peppers abort this process? Okay, it's been claimed that it happens. In fact, the first claims that I ran into was a fellow named John Carpenter in 1953. That was quite a few years ago before we had all of this technology to define these symptoms and the different types of heart attacks. He actually died in 1993, several years ago, but this claim that cayenne peppers abort heart attacks has been reported numerous times, not only by him and his Herbal Legacy company, but by many others on the internet with anecdotal claims. And the anecdotal claims is they put some cayenne peppers in people that are having, quote, a heart attack, and they remarkably get better. And that's the question we're trying to answer here today. Does cayenne peppers abort a heart attack? So cayenne peppers are made of different substances. One of the substances is called capsaicin, and that is probably the most useful substance that a cayenne pepper has. Also, people now are taking cayenne pepper pills to get some of the benefits. So this capsaicin, that's that active ingredient, actually interacts with a receptor called a TRPV1 receptor. So that's one thing it does, but cayenne peppers also have substances, minerals like iron, magnesium, potassium. It has a few vitamins, vitamin A, vitamin C, different phytochemicals that have these capsaicinoids and flavonoids and different beta carotenes. And these are all substances within the cayenne pepper that gives it some benefit for our health. So this receptor that we've talked about, when it's stimulated, it causes a burning sensation. And it stimulates another substance in the body called substance P, and it also stimulates a calcitonin gene-related peptide. So we have the natural things that the pepper is made of. We have this chemical called capsaicin, which stimulates substance P in this calcitonin gene-related peptide. We found out that these two substances stimulates the sympathetic nervous system. That's the stress nervous system that can increase the heart rate, raise the blood pressure. So for years and years, it's been used for weight loss. It's been used to help in pain situations. And it's also been used as an antioxidant, anti-inflammatory. So let's look at some of the studies that have been done through the years on this cayenne pepper and the capsaicin. The first one that I want to share with you is from the Internal Journal of Emergency Medicine. You can look it up. And this was publicized in 2012. And it states that acute heart attacks can be caused by coronary vasospasm, that's this type of heart attack, with the ingestion of cayenne pepper pills in a 25-year-old. So this was, in the literature, I found out that this has been reported as a cause of heart attack via the spasm mechanism, via pills, but it was also reported before this in topical, where they put a lot of topical capsaicin on people as well. And in this study, the author looked at it stimulating the sympathetic nervous system, causing vasospasm. It also had some funny things with the potassium currents. But what this study did not tell me is the exact amount of cayenne pepper that this person was taking it. It did tell me he was taking it to lose weight. So it's been around to lose weight because it stimulates the sympathetic nervous system. And they're also thinking it might have some part to do with some of the receptors that are involved in weight loss that we're seeing now. So that was one study I wanted to share with you. And then I also wanted to share with you the numerous different studies, mainly on rats and humans, about how the cayenne pepper works. We talked about capsaicin, we talked about substance P, but this reference by Sogat, and he published this in 2010 in the Turkish journal. He again talked about hurting the heart by the cayenne pepper pills, sort of like we talked about earlier. A few years later, in the Bioscience, Biotechnical, Biochemical, I ran across an article by Kawabata, which showed that it looks like it was suppressing body fat accumulation, so it was a weight loss medicine, by activating sympathetic nerves. And he actually looked at this in humans. So he studied this in humans. A few years later, another study that I looked at showed again that it does cause vasospasms at different times. That's the arteries to spasm down in certain ways. There was one study that was done by Castle in rats, showed that it could cause funny heart rhythms. It mainly dealt with the different side effects people might have. A couple other studies I looked at, one was called Haichaya, and he published this in the Bioscience, Biotechnology, Biochemical Journal, and he showed that it really worked on humans in increasing the sympathetic nervous activity. Another study that was also published in the European Journal of Pharmacology showed that this capsaicin caused endothelin release. That's a substance that can constrict different blood vessels. And that would go with some of the mechanisms that we talked about so far. So there hasn't been a large studies ever done on cayenne pepper in a person that was actually having a heart attack. But we do see that in a couple studies, it actually caused heart attacks by vasospasm via different mechanisms. Well, a lot of interest happened when this study came out in the Journal of the American College of Cardiology regarding cayenne peppers. And this came out in 2019, and it looked at 24,000 Italians who had chili peppers 4 times a week, and this did show that it decreased the risk of heart disease down the road. Now, this was an observational study. The mechanisms of how it did it was unclear, because in my studies, because there's numerous different chemicals and that capsaicin stimulates different things in the body, no one's really looked at the totality of how it works. But this study was done, and then this is probably the best one I heard. This was in response to this 2019 and 2021. In the American Journal of Preventive Cardiology in 2021, they did a systematic review, a meta-analysis of many studies, basically all of the different studies to date on pepper intake with all-cause mortality. And what they did is they looked at all the studies to date, and they pretty much concluded that chili peppers, capsaicin, cayenne peppers, it does lower all-cause mortality. That means the people that took it had less chance of dying, and they looked at the things that looked like they had a less chance of dying, and it was cardiovascular disease and cancer. Well, that makes sense for cardiovascular disease because remember, the substances in a pepper have antioxidants, which are good. They have phytochemicals, they have flavonoids, decreases inflammation, decreases oxidation. All these things are cardioprotective and help protect against tumor. And that made a lot of sense. And they looked at over 570,000 people that ingested pepper. Cayenne pepper, and they showed that it did have a benefit on mortality, specifically cardiovascular and cancer. They looked at this TRPV1 receptor, and they looked at it and they said, listen, most of the studies showed that it increased intracellular calcium. It did increase catecholamines release, and that helped with the weight loss. And they also suggested that it might have something to do with the GLP-1 receptor as well. So this little chili pepper has a lot of interesting physiologic effects, both from the capsaicin and what it causes it to do in the body, specifically this substance P and this calcitonin gene-related peptide, how it affects the different adrenal glands, but it does so many different things. So it does that, seems to have some pain benefits as well. Then it also seems to have anti-inflammatories, some good things for the inflammation, phytochemicals, which helps in oxidation, which lowers the risk of cardiovascular disease and cancer. So that gets us back to our question that we came in with, natural remedies. I think they're a good thing, but we have to have good evidence, and we have to ask God to help us sort through this. So the question that we came in, does cayenne abort a heart attack? That means, does it stop it once a heart attack is going on? Well, in everything that I've looked at, in my 30 plus years of experience, I would have to say, does it abort a heart attack? We have no evidence that it does. No evidence at all. In fact, back in the 50s, a lot of people had chest pain, and even the anecdotal studies, how would you know it wasn't something else? How would you know it was a true heart attack? It wasn't a GI spasm. It wasn't musculoskeletal. It wasn't something else. We just don't have enough evidence there to say it aborts a heart attack. But in taking care of and looking at the mechanisms of heart attacks, to abort a heart attack, you have to know, first of all, that for sure it is a heart attack and it's not something else. Secondly, you have to know what type of heart attack. And then if it is a type of heart attack, what's the mechanism? And looking at all of this substance P, the different components of the chili pepper itself, I don't see anything in it that would do that would abort either a clot or an acute spasm. We've seen some cases where it actually causes a spasm. So could have it helped in situations of pain? Maybe, but there's not enough evidence out there. So does cayenne peppers abort a heart attack? No. If you're having symptoms and you're thinking you're having a heart attack, I would get professional help, call 911, get to the emergency room so they can sort through these causes of heart attack that I talked about. They can identify what heart attack you're having and decide the best mode of treatment, whether that be very strong clot busters called fibrinolytics, whether it includes anti-spasm drugs, whether it includes a stent, whether it includes nitroglycerin, whether it is even a heart attack at all or not one of these other things that we talked about that can simulate a heart attack. So I think that is the prudent thing to do. In answering this question, does cayenne peppers abort a heart attack? I would have to say no. We do not have any information that says it does. This information started about in the 1950s by John Christopher, where he said it worked on people that were having symptoms similar to a heart attack, and it's been passed on. Many different natural people say it works, it does things. I just can't say there's evidence that this cardiologist can say that it aborts a heart attack. Do I believe in natural remedies? Yes, I do. Do I believe that cayenne peppers have benefits to the heart in preventing heart disease, preventing cancers? Probably to some extent, based on what I've seen here. But would I take it if I'm having symptoms of a heart attack? No, there's no evidence of this. But more useful than all of this information about health is the information we get from the Bible. And when you have a question, when you have a concern, when you have a doubt, when you have a fear, when you want to know something, when you want to find truth, I want to encourage you to open this book and go over this text today, James 1:5. If any of you lack wisdom on anything, let him ask of God. And as you work with God, he's going to work with you and give you these answers to these tough questions. Help you understand how you can treat your body, both natural remedies, the place for modern medicines, but more important than that, the way he can heal you forever, a perfect body someday. He's promised us that. He's given us that hope, that guarantee. So I hope that's helpful for you today in answering that question. I'm Dr. James Marcum, and I'm going to be back soon with yet another biblical prescription for life.